And I do this for a living, actually, and I'm confused by it.
Starting this month, hospitals are required to post all their prices online. Anna Werner talked to health experts who say this rule, meant to make medical costs more transparent, is instead creating confusion.
When Christopher George injured his back last year, a doctor told him to get 2 x-rays. A friend told him about the Price Checker service at St. Luke's University Health Network in Pennsylvania, where George learned he could prepay for his x-rays for about $100 each.
That's why I went there. I knew what I was paying for the first time medically.
But experiences like his are rare. A new government rule requiring hospitals to post price lists was designed to help patients figure out how much they would be charged. The master price list went up earlier this month. But those spreadsheets often contain more than 10,000 items, with names that resemble medical gobbledygook. We found something called an SCSP RPLC PICC. Don't know what it is, but it's priced at about $8,500. Jeannie Pinder runs a website called Clear Health Costs, where consumers can look up medical prices.
It's not comprehensible to the average human being.
So you look at this string of letters and numbers, what's that?
And no idea. And I do this for a living, actually, and I'm confused by it.
At one New York hospital, there are 3 different listings for something called ear, priced at $48,000 to $110,000. There are 5 more listings for other ear, procedures costing from $27,000 to more than $150,000. What's more, Pinder says the prices aren't real.
They're fanciful, they're inflated.
Explain that.
So hospitals have a list price that's very much like the manufacturer's suggested retail price for electronics or a list price for a car. Very rarely is the hospital ever paid that actual list price.
That's because those list prices don't take into account the huge discounts negotiated by Medicare and private insurers, which are considered trade secrets. Pinder worries patients may be misled about their actual out-of-pocket costs.
You might find this wildly inflated list price and decide that you can't afford it and choose not to get treatment.
Jeannie Pinder says there are a few things you can do. First, look for the medical code. That will help you zero in on the actual item on the price list. Ask if there are other charges, like surgical room rates or medications or additional tests, and ask how much it would cost with insurance and without. Finally, get everything in writing. Anna Werner, CBS News, New York.
A new study published in the journal Pediatrics finds the HPV vaccine appears to offer considerable herd immunity. That happens when a high percentage of a group is vaccinated. It makes it harder for disease to spread because there are few susceptible people left to infect. HPV infections have dropped significantly since 2006, even among women who were never vaccinated.
Coming up on CBS 2 News.